This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Jeremy Wolf.
Oh, hello, everyone, and welcome back. I was recently at the Chamber of Commerce luncheon, and I met our next guest. Actually, I didn't meet him, but I met his lovely wife. He had to step out a little bit early. But as you guys know, anytime I encounter a new business through the chamber, I always like to extend an olive branch and invite them on the show to learn a little bit more about what they do and how they help our wonderful community. So today our guest is Gayan Poovendran, and Gayan joins us from Pro Institute. Gayan, welcome to the show, brother.
Thank you so much. I really am honored to be here. This is really cool and exciting for me.
Yeah, happy to have you, man. And thanks, as always, to our listeners for tuning in to learn more about our great community and the businesses that serve us. Without further ado, why don't you tell everyone a little bit about what you guys do at Pro Institute?
We are a regenerative orthopedic and sports medicine practice. Pro stands for Poovendran Regenerative Orthopedic Institute. And I brought my experience from the general medicine or allopathic normal MD school to a more alternative natural healing approach to healing orthopedic injuries. So we utilize a lot of things like peptides, PRP, which is called platelet-rich plasma. We use stem cells, not the ones you get from the bottle, but the ones from your own body. We do different nutrient IVs. We do ozone therapy. We do some nutrient testing. There's a whole bunch of different things that we do to try to optimize the body from the inside to help it heal better. And then sometimes I have to do injections as well.
I've been doing a lot of podcasts lately I just did one with my podiatrist the other day, and we were talking about this whole idea of regenerative medicine. And I've done a lot with various businesses that are in the holistic healing space. And there's been this common theme, and I think it's happening because as I get older, I'm more attuned to this. I'm more aware of the body's ability to heal itself. So I am really fascinated by the approach to this holistic regenerative medicine. Can you speak a little bit? You just mentioned some of the various services that you offer. Can you speak a little bit more about this distinction between traditional medicine, sports medicine specifically, and this idea of regenerative medicine and healing from within? Like for somebody that hasn't heard about that or has heard regenerative medicine but doesn't really know what it is, go down that rabbit hole a little bit.
Sure, be happy to. My residency and my fellowship were in sports medicine as a non-operative doctor. Okay. And so typically or traditionally, if you were to come and see me in that type of office when I was working in an orthopedic office, I would evaluate you. I would say, oh, you have a knee injury, maybe a meniscus tear. Let's do some physical therapy. Maybe let's do a cortisone injection, do some medications, try to manage the symptoms. If it doesn't get better, go to surgery, right? That's what ends up happening with a lot of patients. So I got really frustrated with I feel like I have really good skills with my hands and I wasn't getting to use them very much. So with regenerative medicine, what we do is we harness your body's own ability to heal itself, because just like when you cut yourself on the arm, your body is going to heal it. So what we do is we'll take either stem cells or PRP, inject it into whatever is injured, and then that stimulates it to heal and make it feel better. That works on meniscus tears, rotator cuff tears, labral tears, arthritis of the knee, arthritis of the hip, anything that really can cause a lot of aches and pains. We're able to help heal those, not just by masking it, like a cortisone injection we talk about to decrease pain. It just masks the symptoms, and in the end, we know that it makes things a lot worse. Whereas these injections or these treatments actually help roll the clock back so that we're not having the cause of the pain anymore.
It seems like a no-brainer to me to at least attempt to heal the body through this idea of regenerative medicine, as opposed to just going straight to the more invasive types of procedures. Now, do you also, I'd imagine that you also do the surgery aspects of it? Do you run the full gamut, or you just specifically focus on the regenerative side? And if the issue can't be addressed through that, you refer them out to a surgeon if they ultimately need surgery?
Yeah, that's what my treatments stop when the injections or the needle-based therapies don't work anymore. So if somebody needs to have a surgery to fix whatever, then I'll refer out. Surgery is sometimes the answer. Sometimes patients do come to see me and they're too far gone. I can't help it. But there are so many patients that I see that they have a partial rotator cuff tear that their surgeon says, oh, you did 6 weeks of physical therapy, let's operate on it. They don't want to. I fix them. And then they have to go back to their surgeon and say, hey, I guess I don't need the surgery anymore.
Mm. Are you finding that through these non-invasive regenerative approaches, you're getting a very high level of success with patients, or is this something that works for some period of time and then often needs to go, or I guess it just depends on the case, right? Depends on the individual, but
It depends on the case, it depends on the individual, and it also just depends on what's going on. So the main focus of these treatments is to heal the injury. So people always ask me, is this permanent? It's as permanent as a surgery is going to be. It's as permanent as your body or the biology is going to allow it to be. So like a rotator cuff tear in the shoulder, we can heal that and it's not going to tear again until 10, 15, 20 years down the road when it's going to naturally wear down and degrade. Arthritis, which is a degenerative condition, tends to be a little bit different. That one requires a lot more maintenance. We do those injections maybe once a year, once every 18 months, just to keep things as healthy as possible on the inside. But it's not like it's not a temporary fix where we're just masking it for a couple months and moving forward. I do agree. It's a no-brainer for a lot of these conditions that I see and treat that people try this. I've had pretty good results. I've been doing this for 12 years now, I believe. I think that part of my success ends up really being because of patient selection. I am very selective on who I think this stuff will work on. And I use a lot of the evidence from the conferences I go to and I teach at. When we get 70 to 80 to 90% success rates, I get to be pretty bullish on how well these things work.
you mentioned earlier that you were frustrated by the old school way of going about this. What ultimately seeded that frustration? And does this go back to before medical school, that you've always had this kind of like holistic approach to medicine? Talk a little bit about how you evolved into this specific field of regenerative medicine.
So I think with most things that people are passionate about, there's a personal story involved. And for me, it is the same thing. When I was a junior in college, I hurt my shoulder lifting weights. I partially dislocated it. My dad is a doctor and he's a pain management doctor. So I went and saw him like when it was getting to the point where it was bad. He had me see two of our family friends who are orthopedic surgeons. And their solution to me was, we can operate on this, but you're better off not and just dealing with it.
Great advice.
Like, it was like,
just
they're like, oh, the same doctor advice, if it hurts, don't do it. I'm like, you know what? I'm 20 years old. I want to lift weights. I want to play basketball. I want to play golf. I want to play tennis. There's all these things I want to do. I can't not do them at 20 years old because my shoulder hurts. So my dad and I got on this regimen of, he had me do physical therapy and then he was giving me cortisone injections. And after the first cortisone injection probably lasted me 9 months, a year, give or take. And then the next only lasted 3 or 4 or 5 months. And then we did another one and it only lasted 3 weeks. Yeah. And I'm just like, I go and ask him again, hey, can I get another one? He goes, no, you can't do it that many because it's going to do damage. Yeah. So then we go and talk to my friends, the surgeons, and they tell me, we can operate on it now that you've failed the normal conservative treatment, but you're going to have to be in a sling for 6 weeks or 8 weeks. And it's going to be another 3 to 4 or 5 months of rehab before the shoulder feels good. And here I am, a 21-year-old at this point, getting ready to go to medical school. I'm like, when am I going to figure this out? And so from medical school, I just kept dealing with it. And then once I got into residency, I was really into sports medicine. I've always been into sports medicine, but I started like looking at different ways of healing things naturally. So I started by, I don't know, it was like an in-flight magazine where they talked about growth hormone injections. Like, oh, maybe if I injected growth hormone into my shoulder, that would help. Never ended up going down that route because luckily when I was in residency, there was a sports medicine fellowship with a doctor that was doing some of these regenerative things. And he talked to me about PRP. And so I switched focuses from, again, traditional regenerative medicine or traditional sports medicine stuff to more the regenerative side, or that was my passion.
Yeah, that's pretty cool how you landed into that. Yeah, we were having that specific issue, and then you were in a situation where you could test the waters on yourself to see how things went and validate what you were looking for. Reminds me of a story for myself. I herniated my L1 S5 lumbar way back when. And I couldn't, whatever I did, I got the epidurals. It worked just like you said. The first one worked really well. The second one, not so much. The third, by the time I did it, the third one didn't have much of an effect. I was getting acupuncture. I was doing all sorts of things to avoid getting a microdiscectomy. And I was one step from getting the surgery. And somebody finally recommended to see a chiropractor to try disc decompression, spinal disc decompression. And I went into that machine, and it took a while, but after going 2 times a week for several months, finally got the pressure off the nerve, and I was able to get back to normal. And I haven't had an issue really since. And that was all done through, I guess you can call that regenerative, right? It's through the body, right?
Yeah, it's your body healing itself. I think people forget about how important the chiropractor or the physical therapist can be. Because a condition like yours that you're talking about, part of it is the alignment is off, right? So you correct the alignment on the top. Like I can put a new tire on, but if your alignment is still bad, the tire's going to go bad again. Whereas the chiropractor, the physical therapist, they're going to adjust all of those motions and the way that your muscles fire, so that way it doesn't keep bothering it. And the decompression obviously helps, but getting those muscles, I'm sure they did some other work to get the muscles stronger along your spine, which ultimately is what gave you the long-lasting relief.
Yeah. So I met at the chamber again. I alluded to at the front of the show. I didn't meet you personally. I met your wife. She also works with you at the practice.
She is she's the boss. She's the practice manager. She's the one that tells me what to do, when to do it, how high to jump.
So how did you meet her through the field? How did tell us a little bit about how you guys linked up and how you ended up working together and starting this practice together?
So we actually met a long time ago when we were in college. So I met her when she was a freshman in college and I was a junior or senior. So right around the time where I hurt myself. Interesting story. My girlfriend at the time and her boyfriend at the time were brother and sister. So the 4 of us used to spend a lot of time hanging out. Nothing ever happened, nothing crazy like that. But after I graduated college, we went our own ways. I went to medical school. We would talk once in a while, just friendly. And then one day, a couple of years ago, she like sent me one of those messages on Instagram. It was like, "Hey, how's it going?" And then we like literally didn't stop talking after that. It was like one of those like weird, like it was the right time. Now we're going to reconnect. So we reconnected. She was living in Ohio at the time. This was right before the pandemic. So she flew down for 2 weeks because it was just a 2-week lockdown, and she ended up never going back. And then during that time, she saw me go through 2 different sports medicine practices where I was employed by other people. And she saw the frustration in me on a daily basis of not necessarily being able to do things the way I wanted to, or implementing new therapies when I think that they're good because the business people behind it don't understand it. So she was a little bird in my ear that said, "You could do this on your own. You've been making people a lot of money for the last couple of years. Why don't you do it for yourself? Why don't you do it for yourself?" And finally I said, "Okay, you know what? Let's do it."
Good stuff. I always ask this when there's a husband and wife team.
Mm.
What is one of the most rewarding things about working with your wife? And on the other end of that spectrum, what's one of the biggest challenges about working with your wife?
I think most rewarding is I know that we're both equally invested in the success, right? Because she wants to see me succeed financially and emotionally and professionally, and she wants to see me keep going and climbing. And she's just as invested in that as I am, which you don't get with just anybody, right?
Mm-hmm.
One of the challenges on the other side of that is
Careful. Think before you talk, because she's going to listen to this.
She's going to listen to this and she'll agree with me.
Okay.
The biggest challenge is the brain never shuts off, right? Because we'll do stuff here at work and then we're thinking about stuff at home, and then at 10:30 at night in bed, I'll be like, "Hey, wait a minute, what about this idea?" And she'll be like, "Really? It's 10:30 or it's 11 o'clock at night," or the vice versa. She'll be like, "Hey, did you think about this?" I'm like, "I really don't want to think about this right now. I need to decompress." That's the hardest part. It's all for the greater good.
Yeah, separating work from personal, just sometimes knowing when it's right to maybe put that thought down on a notepad for the next day and not bring it up. But you get so excited when the thought comes up in your head. You're like, "I want to share this with you right now." I can see how that could be interesting. So do you guys have kids?
No kids. We've only been married we're going on 4 years now, but we're working on the kid part.
Very cool. What would be, looking back, so what I found through my life experiences is that I'm often defined by my most challenging experiences more so than the rewards or the triumphs that I've had, right? Like the good stuff is great. Don't get me wrong. But the things that you go through that you really struggle with in life, that at the time you're going through it feels like the end of the world and it feels like there's no hope. But then retrospectively, looking back at it years later, you can say, wow, man, I'm really grateful for having gone through that experience because it really helped shape me into who I am today. Is there an experience like that comes to mind throughout your journey, something that you struggled with, a hardship, a challenge that really helped to define you into who you are today?
I think right now I'm going through one, right? Starting this new business that it's only been open for a year. So I've gone from a very stable life where patients were just showing up at my door and I was getting a nice paycheck and a nice salary and all that kind of stuff. And now I know that in the future, I'll look back at this and be like, of course it was worth it. And you knew you were going to succeed. But when you're in the weeds, it's sometimes challenging. I've had similar situations like that in education, right? Here in college, I never thought I was going to get into medical school. And then medical school, they teach you how stupid you are the entire time. So you're like, I'm never going to get through this. I'm going to just kill everybody when I get into residency. And then residency, they're telling you, don't kill anybody. And then you're like, am I ever going to make it through this whole treatment thing? And it was the medical education system is very challenging and you never think that you're really going to make it through. And then when you do, you look back and you miss. There's a lot of stuff that I remember complaining about in the moment. Like when I was in medical school in the Caribbean, I'm like, man, I hate it here. I don't want to like I'm in paradise and I'm studying. But then you look back and you're like, man, all my friends were like 2-minute walk away from me. And now we're like all around the country. So it's just interesting how your perspective can change when you're removed from the trauma, the direct removal of trauma.
Indeed. And appreciate you sharing that. Yeah. Starting, I speak to tons of local business owners on the platform. And if you haven't run a business or been an entrepreneur or started something from scratch, you don't know. It can be extremely frightening and a harrowing experience because your specialty lies in medicine, right? You went to medical school, you're a doctor, right? You deal with regenerative medicine. But as a business owner, now you got to deal with, and it's great that you have your wife to help you with all this, but now you got to wear every single hat, right? You also got to be a boss. You got to be a administrator. You got to do all these different things. And it can be very difficult, but you nailed it, right? That if you just put in the work now and do what's required, it'll all pay off in the end, as it always does.
And I'm very lucky that my wife has a much better business mind because you're right. Like I spent my entire time and my entire education learning about science and healing and helping people. I never learned about the business aspect of it. I had a really interesting meeting with a kind of a mentor the other day, and he was telling me, you know what, you don't need to, you've gotten to the point where now the regenerative medicine is second nature. It's not something you have to think about. You just know what to do. But now you have to go through the next part of, now you have to be a business owner. Now you have to be, as you said, a manager. Now you have to think about marketing and all these other things that the entire time of your career, you're like, that's somebody else's job. Now it's mine. But thankfully I have my wife that can do those things really well because that was her trade.
Yeah. They can often do them a lot better than us, can't they?
Absolutely. If you look at some of the stuff that I put together, and then what it ends up being after she gets her hands on it, you'd be like, oh my gosh, that's so great. But if you look at what I did, it's a third grader did it.
Guilty as charged. I'm not alone there. What would be one thing that you'd like to leave our listeners with? It can be about the business. It could be about life in general, piece of wisdom. One thing you'd like to drop, one nugget.
I think my best nugget would be about the practice of medicine and how it's changing. I think as a layperson, it can get very daunting seeing all the options and being frustrated by the options, but know that there are doctors and there's practitioners like me that are thinking outside of the box and actually looking for solutions to help people heal, as opposed to just covering it up or trying to run through the system or run through their clinic day.
Yeah. That's one of the things, again, I always say on the north side of 40, I'm 40, be 45 soon. I've been on this journey and I just never ceases to amaze me how much of a capacity the human body has to heal itself, and how we live in a society, this instant gratification, quick fix society, where everybody's looking for the magic pill, the one thing that you could do. And there really is no magic bullet for any of this. It all goes back to lifestyle, right? your diet, what you put in your body, how you take care of yourself, your exercise, all this stuff that seems so simple on its face, but everybody has such a hard time implementing on a daily basis. And I see a lot of that in you, this approach to medicine in trying to treat the underlying issues and really truly heal yourself, as opposed to just slapping a Band-Aid on, which so many, unfortunately, in the medical profession do nowadays. It's unfortunate that we live in a system that's like that. So it's a breath of fresh air to see somebody like you doing what you do, Gayan.
Thank you. I appreciate that. But it is frustrating when when I was in my first practice in the very traditional sense of orthopedics and sports medicine, 35, 40 patients a day. It's really hard in that little time to give the level of care that people deserve.
Yeah.
Even the other day I was working out with one of my colleagues in the area who's more in the university. He's at the university doing what I do. And we were talking, I can't even get my ultrasound out to look at to diagnose the patient because my athletic trainer or my medical assistant we have another patient that's waiting, or we have 3 more patients that's waiting. Whereas a setting like this, where you are maybe outside of the insurance system, but you get all the care. Each one of my patient visits, a new patient visit, is an hour. You get an hour with me to sit down, to talk to me. I examine you. I do an ultrasound. I diagnose. I do whatever I can. The stuff that I can't do, if I need an MRI, then I order it, right? And then we move forward. But I have found in my career that spending that little extra time usually helps me find an answer that most people aren't looking for. Yeah. Or aren't seeing.
So for anyone out there listening that is experiencing problems and they're frustrated like you were with their condition, they'd like to reach out and learn more, what's the best way to connect with you guys? Maybe share your website and your contact information.
So our website is Pro Institute, pro-institute.com. And our phone number is 305-209-1951. We're located in Davie. We're on State Road 84 in between Nob Hill and Hiatus Road. Kate or Geeta will talk to you on the phone and you'll be in love with them. And then you'll come and see me and hopefully still have a good experience.
Perfect. And we will, of course, drop a link below in the description to all of your contact information so folks can reach out. Gayan, it's a pleasure having you on the show, brother. It was really nice learning about your story and what you're offering to our community. So thanks for joining us.
Thanks so much, Jeremy, for having me. I really had a good time.
I'm glad to hear it. And thanks to our listeners for tuning in. And we will catch everyone next time on the next episode of the Good Neighbor Podcast. Everyone take care and have a blessed day. Bye-bye.
Thanks for listening to the Good Neighbor Podcast, Cooper City. To nominate your favorite local business to be featured on the show, go to gnpcoopercity.com. That's gnpcoopercity.com, or call 954-231-3170.